Hi, this is Dr. Franz, and this is our next tutorial on lung sounds. Okay, empowering parents to be able to do simple vitals and, have a great virtual visit, as it were. All right, so you have your child. Okay, again, you have your stethoscope, which you can get from Amazon.com or any place. Even the medical stores have them. Amazon just has good prices. So, or any site that you are comfortable with. So then you're going to take either the big head or the little head, and we're going to listen to the lungs. Now with lungs, we listen front and back. So we're going to listen, and these are going to be the upper lobes. We listen in the front. There's the right middle lobe, so you can listen here. We get the most bang for our buck in the back. And you'll even notice when your doctor listens to you, it's usually at the bases. Okay. And listen for more than one breath. And normal lungs just sound even in and out. It's a smooth airflow. Become familiar. Listen to yourself. Okay. Then when they have a cough or they're sick, then we're going to get into that in just a second. All right, so lung sounds are that easy in and out flow. I'm going to bring up a video for you to just look at to see the title so you can listen to it yourself, since I can't get it to play through in my video here. But things that are abnormal, okay, are what we call rhonchi. Now, rhonchi are kind of like coarse, wet sounds, typically more infection up here in the bronchioles, in the big bronchi, okay? Then there are crackles. Now, crackles are best described as walking and popping bubble wrap, or like Rice Krispies Snap Crackle Pop when you pour milk on them, truly, okay? And stridor, we typically see in croup or foreign body aspiration. Stridor is a usually more inspiration, trouble getting air in. Wheezing is more expiratory, although it can be on inspiration too. And it's a high-pitched sound, usually up here. And it's, in is good. Out, or okay, it can have like a musical tone to it. Very common in asthma, RSV. It just, you're like, whoa, that is not normal. No, it isn't. Okay. If you have a known asthmatic child, you really probably know what that's like already. This just gives you added dimensions. Asthmatics, many times we can still see virtually. If you are hearing crackles, though, like walking on bubble wrap or Snap Crackle Pop Rice Krispies, we're going to want to see them. Crackles in children, we generally think of pneumonia. Okay, so you do want that checked out in person. Stridor, often, as I said, in croup, yeah, we're going to want to see them. Sometimes we get an x-ray because if it's a foreign body, then the foreign body is down the right side often. And these are not things we're super comfortable doing virtually. So that is the point of this tutorial. Okay, when it's normal or some wheezing, okay, and some infections, easy, we know what to do. And we just are engaging you to be our ears, which is so amazing because you're our source for so much information on your child already. Okay, so this video is from the Lung Sounds collection. It's really pretty loud, but it does give you a good sense of these sounds. Now, excuse me, you can still YouTube looking for other ones, okay, if you want to just, get all intense about it. But this was a nice one from the EMT collection. Okay, so now you know from previous videos how to do the height, the weight, the temperature. All right, now we know how to listen to the lungs and how to listen to the heart. For both of those, for you, count the heartbeats for 1 minute, 60 seconds. Count the respiratory rate for 60 seconds. That is important. And the respiratory rate in infants will be 40 to 50. In 1 to 2, 30 to 40, 2 and up, 28 to 30. Okay. So this is true though. If you have a respiratory rate, breathing rate of 60 per minute, child needs to be seen. Okay. Now, in a brand new brand new newborn, sometimes that's a little normal. We're talking older when it's not. You've got that 3-year-old who's got a fever and is breathing 60 times a minute. Well, yes, the fever makes them breathe faster, but 60 times a minute, we want to see in person or have you seen in person, because that is a red flag or a higher risk indicator for pneumonia. So that is a great tip for today. Okay, thank you so much for listening. Now you can do it all. Good job. We believe in you, and we'll see you next time.